The Winter Olympics in Beijing are looming ever closer, and China is being put to the test as it battles to contain outbreaks of the highly contagious Omicron strain of COVID-19. China has adopted a zero-COVID policy. That means strict restrictions in public life in many parts of the country. So is it working, or might it backfire? On To The Point, we ask, Olympic struggle, can China beat Omicron? Thanks very much for joining us here today on the show. And in the studio with me is Suji van Brunnesum from DW's Asia desk. She says a zero-COVID policy might have benefited China in the last 2 years, but Omicron and the Olympics could be a game changer. Also with us is Tobias Kurt, a professor of public health at Berlin's Charité Hospital. He argues nothing can stop Omicron. It can only be slowed down. And a warm welcome too to science journalist Kai Kupferschmidt. He says, with much of the country vaccinated, the question of what an exit from zero COVID in China could and should look like looms large. Thank you for being here, all three of you. Thank you for those interesting comments. Lots to talk about, so let's get on with it. Suji, the eyes of the world are on Beijing, that's for sure. The stakes are high. What is your feeling? Is a large-scale outbreak of the Omicron variant likely in China in the near future?
I think because the high transmission rate of Omicron, it's something very new China is dealing with at the moment. And I think China will do everything in its power to try and contain and not lead to an outbreak during the Olympics, as well as we kind of have a perfect storm situation because we have the Chinese Lunar New Year. That is on the 1st of February, which is usually the period of the highest migration in China. And even though the Chinese government has advised everyone to stay at home and not travel, and they are taking a lot of precautions for the Olympics. They're fencing off all facilities, and athletes are being ferried to the campus and having every day a test. And if you're vaccinated, you don't need to quarantine, but all the precautions are in place. But I think with every single Omicron case that arrives in China, every single case will weaken Xi Jinping's zero COVID policy. And I think that in the future, we can, as you said before, we can only slow down Omicron. But I think China will stick with the zero COVID policy for as long as it can.
Okay. Kai Kupferschmidt, I just wonder, you know, a lot of people must be listening to these kind of comments, looking at the situation at the moment and wondering why on earth is an event like the Olympics being staged at all at this time and in this place?
It's a good question. I mean, of course, from the Chinese perspective, I think it's also it's an opportunity to prove to the world, you know, the superiority of the Chinese approach to SARS-CoV-2. I do think we are in this phase of the pandemic now where these questions about how much can we go back to normal life, what are the things that we, you know, that we can do, and can we do them safely, is an important question. And I've always been a little bit skeptical of risk mitigation being basically avoiding all risk, right? I mean, the question is, how do you stage an event like the Beijing Olympics? How do you try to do it in the safest way possible? I mean, the bigger question that I have really is, how long can a country keep the zero COVID strategy up? And I think it's not completely clear at the moment because there are some questions about Omicron. How much more transmissible is it really than Delta? We don't really know that. We know it's much better at infecting people who have some immunity, but that doesn't mean that the virus itself is more transmissible necessarily. And so, you know, I think what we've learned in this pandemic again and again is that politicians, policymakers need to be very flexible. They need to look at the data. They need to be able to navigate a constantly changing environment. And I think what you just said, that China is going to hold on to this policy as long as possible, I think that in itself is a bit of a danger, because really you want to be flexible, you want to be nimble, you want to act fast, and also give up these policies when it becomes clear that they are causing more hurt than they're actually contributing to the public health in a country like China? And I think those are the big questions for 2022.
What do you have to add, Professor Kurt, to those in terms of hard data, hard information, to the questions that Kai Kupferschmidt has just been asking?
So data are important. We don't know the data from China. I'm sure China is collecting data like crazy, but the public doesn't know much about it. So zero COVID obviously failed because Omicron has arrived in China. So it's more the strategy, like as little as possible until the Olympics for sure. But even during the Olympics...
Is China admitting that it has failed here?
Certainly
not. At all.
Certainly not.
Oh.
I mean, the restrictions are massive and they try their best to really keep it quiet and down as much as possible. But now, during the Olympic, many people come to China. There will be clusters within the athletes group, the journalists, as we see now with the handball European Championship. No matter what measure you do, and Germany, I think, had good measures and 13, 15
Large
people
numbers of
infected.
people
So
infected, yeah.
that is not going to work.
OK, we talked about it already, so let's take a closer look at China's zero COVID approach, which is under pressure, to put it mildly.
This is what China's zero COVID strategy looks like. Even with just a few known coronavirus cases, the government is imposing strict curfews for whole metropolises comprised of millions of people. It's an extreme lockdown. The affected cities will be sealed off, and residents will only be allowed to leave their homes for daily COVID tests and shopping, if that. The policy is strict but effective. China claims to have the lowest infection rate in the world. Until now. Their first Omicron cases were reported in early January, and authorities are deeply concerned because China's Sinovac vaccine doesn't seem to offer much protection against the Omicron variant. The Winter Olympics are just around the corner, which means that tens of thousands of foreign athletes, officials, and journalists will soon be entering the country. They are supposed to enter a strict quarantine upon arrival, separating them from the rest of the population. But experts still wonder, will there be a massive outbreak of the Omicron variant in China?
And one of those experts is Tobias Kurt, and I'd just like to come back to that question. Do you think they can keep a lid on this? How concrete can you be about that?
Not for long. I think the Omicron variant has shown to be so transmissible in other countries, and that will also happen in China. You can slow it down, but I don't think you can really stop it.
How do you slow it down?
Well, these are the most strict measures that we can think of right now, and I agree with Kai Kupferschmidt that it's hardly imaginable that you can keep this for months to really keep it down. It won't be possible. So at one point, I expect to see a rise in cases in China. Yeah.
Kai, what do we know about Omicron, and what do we need to know?
I think one thing that sometimes gets a little bit lost, we just saw it in the clip, that the vaccines don't seem to offer a lot of protection against Omicron, I think was the phrase. You really have to look closely at that. What that means is protection from infection. We do think that basically all the vaccines that we have at the moment do offer significant protection from severe disease and from death. Mm-hmm. And that's really, really important because while the virus spreading like wildfire through China would still be a huge issue in terms of disruption to work and all of these things, the hope is that it wouldn't lead to the kind of wave of deaths that we've seen in other countries earlier. Mm-hmm. And so I think it is important to realize that we're talking a lot now about the potential risk for China in 2022, but they are in an enviable position in some ways. I mean, they have managed to weather this pandemic a lot better than a lot of other countries have. They have avoided these big waves, and whatever happens now, they are not looking at the kind of death wave that we've seen in Spain, in Italy, in the US, in the UK. But you need to be able to also shift from that strategy at some point, because otherwise you can really be creating a lot of hurt in those moments where you're clinging on to a policy that maybe at that point isn't really helping anymore.
What do you mean with creating a lot of hurt?
Well, I mean, if you imagine that Omicron starts spreading and the only answer that the government has is to lock down more and more places for longer and longer, then those are huge side effects that you're basically, willing to have the public suffer in order to keep the virus from spreading. But at some point, of course, the risk of this virus spreading might actually be lower, at least the risk in terms of public health. The political risk is, of course, a different one. And that, just like we're seeing in the UK at the moment with Boris Johnson lifting all restrictions, I think whenever you look around the world, you have to look at the politics in these countries, within the country to understand a little bit why certain decisions are being made. It's not just the scientific evidence, as we all know.
And, Suji, what do you know? What can you tell us? I know it's difficult, but what can you tell us about how the Chinese people are responding to all this uncertainty about what sort of knowledge they have at their disposal, how the government is sort of working with them, whether the government's priority is the people or the games? These are very difficult questions.
I think in general, most Chinese people do support the government's decision to keep a zero COVID strategy. And I think China has, in accordance with its knowledge of its health system, it's set up COVID policies which will suit its healthcare system. And currently, most hospitals in China, for example, in Shanghai, we haven't even seen many cases of Omicron, but the hospital is already burdened with too many patients. And so the main priority currently of the zero COVID strategy is China knows that its hospitals nationwide will not have the capacity at the moment if the coronavirus were to have waves as we had here in Europe. So,
but the current vaccine that China is using simply won't work against the new variant. So but it has to work. The Chinese government have got a really big problem there.
Well, potentially, yes. So, as Kai Kupferschmidt said, we expect not that many severe cases, but if you have many people getting infected, then if the likelihood is lower that you get severely infected, still a lot of people will get severely infected, vaccinated or not. So one has to stay flexible, really. One has to stay watch the situation more dynamically and then act. So just having one strategy for as long as possible is very difficult to communicate. And I also think that the suffering of the population in terms of public health consequences outside of the viral infection will be severe in China.
Mm-hmm. How much of a threat is this to the credibility of Xi Jinping as Chinese leader?
I think that China can withhold, for example, if there's an outbreak, I think for 1 month of quarantine, we can predict that China and the population will be able to deal with it for 1 month. Mm-hmm. But, if it carries on and the virus spreads, and then we have entire cities and ports in lockdown of more than 6 months or leading up to 6 months, people will definitely get frustrated and people will lose their jobs, and companies, global supply chains will be hit. And I think, of course, the Xi Jinping government also wants to keep people happy with the government. And they know that anything beyond 1 month of lockdown will definitely get people very frustrated towards the central government. Mm-hmm.
As a journalist, where do you see that situation leading? You've got the problem with lockdown, the threat to the economy. You've got the public health threat. How's that going to be knitted together, or how is it going to impact China in a drastic way potentially?
Yeah, I mean, I do think that this year at some point we are going to see a massive impact on China, whether it is because of the public health restrictions that are put in place in order to keep Omicron from spreading, or because Omicron spreads. I think, at least in the future, when we look back, I feel like a lot will depend on how well China is preparing for Plan B. I mean, given the very clear risk that Omicron is going to spread, the question is, what are people doing, what is the government doing to prepare for that eventuality?
What do we know there?
I honestly couldn't say. I haven't been following enough what's being said in China. I think at the moment, all that I'm hearing is still we are, committed to the zero COVID policy. But I think it would be ludicrous if people weren't in the background, gaming out, okay, what can we do if this really spreads? How do we keep the disruption low? How do we make sure hospitals are staffed? How do we make sure if there is a big influx of patients with severe disease, how do we deal with that? That is really what people are going to judge the Chinese government's actions in 2022 on, I think. Mm-hmm.
And what do you think, Tobias Kort, about what does this tell us about sort of other similar events in the future, like Bundesliga football matches in Germany or the Carnival in Rio, or all these large-scale events that are so important for humanity?
Well, I think we need to understand what is actually happening, collecting data meaningfully and not just comparing cases to nothing. So I think we really need to be flexible. You cannot compare a strategy in one country and bring it to another country and that works. So we in Germany have to decide what is our measure where we say, okay, go. How many infections or how many severe infections after a soccer game, football game we accept. So that's something we need to discuss. But like keeping everything away from the people for a long time won't work.
OK. The Omicron variant is spreading at a pretty much unprecedented rate. At the same time, though, people in some places, at least some countries at least, are again out enjoying packed bars and packed streets. How does that work? Indeed, does it work? Let's have a quick look.
The Omicron variant is giving researchers reasons to be both concerned and hopeful. They're worried because the virus is much more contagious than its predecessors. They're hopeful because it also appears to be less severe by comparison. Germany's leading virologist predicts that the disease will become a controllable endemic rather than a prolonged pandemic. We already expect that we will reach this endemic state, or virtually reach it, by the end of the year. He says the prerequisite for this is vaccinating and boosting the elderly and other at-risk communities. That's already the case in Israel, where the government has lifted nearly all coronavirus restrictions, despite an increase in infection numbers. Life on the streets appears to be getting back to normal. In Spain, people wear masks voluntarily. Large parades like this one, as well as restaurant visits, are all possible without restrictions. Just how dangerous is Omicron?
That is the big question, Kai Kupfer-Schmidt. I mean, we see people out on the streets in that report in Israel and Spain, for example. And here in Germany, at the same time, my sense is that we're standing on the cusp of a possible huge or very large-scale crisis in the next 2 or 3 weeks. That is what we're being told.
I think it's very important to kind of paint a very differentiated picture about what the risks are here. We have, in the last 2 years, talked a lot about these catastrophic risks of lots of people dying. We have seen more than 100,000 people die in Germany of COVID-19. That is not what we're seeing. That is not what most scientists are worried about if we look at the next few months. Mm-hmm. Most of the worry is that we still have a lot of unvaccinated people in Germany compared to Spain, for instance, compared to Israel. So that means that we do have the risk of some people having severe disease and death. But the majority of people are vaccinated, they are protected from severe disease and death, but they might be sick, they might have to isolate. A lot of people might have to quarantine because they've been in contact.
Is that already happening in your circle here in Germany? Because people are talking about that a lot now.
Yes, it's very clear to me that we are at the beginning of this very, very steep rise of cases that we've seen in other places. Because we had measures in place for Delta, that was delayed in Germany, but we are now seeing the same kind of rise that we've seen in places like Denmark or Spain. So everybody's going to experience this in their circle. They're going to see a lot of people get sick and isolate, but it's not the same worries that we used to have. And I think that is very important. Now, endemic doesn't come from the word end, right? Endemic just means this is a virus that is here to stay, but most people who get infected with it already have some kind of immune memory of having been exposed to the spike protein, ideally through a vaccine or through natural infection. And so the societal implications are different ones, but there are still societal implications. Like we said with China, if everybody is sick of work, that disrupts supply chains. In Germany, if a lot of doctors are out sick from the hospitals, you still have a problem with having enough people there for all the other diseases that people have that aren't COVID. And so we have to take this seriously, but we also have to realize that this is a different level of worry, I think, than what we were worried about the last 2 years, and that's thanks to the vaccines. And frankly, the biggest thing we can still do is to make sure that the people who haven't had a single shot of this vaccine get one, and that goes for Germany, but it certainly also goes for 3 billion people worldwide who haven't received a single shot of this vaccine.
Sure. Suji, how concerned are you personally?
Personally, if I'm being very honest, I have a family in China, elderly relatives, and I think personally I feel more comfortable for some reason, whether it's rational or not, that they are in China with a zero COVID policy at the moment than if they were here in Europe. And when I think about my relatives saying, oh, I'll come visit you in Europe, I'll say, no, it's better not to come. Also, my other family is in New Zealand, which is also zero COVID strategy. And I feel a level of comfort for whatever reason, that
That's
they
very
are in a zero COVID strategy country. But in saying that, I have so much more freedom. And I can travel in the summer, and when the cases are down, I can come in here to the office. So I have a level of freedom that they are not enjoying, for example, and I can still go abroad within Europe and even other countries. So yeah.
Professor Kurt, what's the worst case scenario for Germany in the next couple of months for you?
It's the worst case scenario is that we're getting more severe sickness than we think we're getting. So that will be something where we're adding on the issue with the quarantine. People are not able to work, and we're getting more and more patients in the hospital. So it's actually already starting that physicians and nurses are not as available as before because of they're in quarantine or their kids are in quarantine. So and if this is increasing, then the question is, can we keep the system running? And if then severe cases come, which we do not expect to happen because of the vaccination, because of what Kai Kupferschmidt explained, then we are running into a real issue. But I don't expect that to happen.
Yeah. And what can we learn from countries like Israel and Spain, where there's definitely a different approach?
It's always very difficult to compare countries. So in Israel, the elderly population are vaccinated. So as a country, the vaccination rate is lower than in Germany, but the higher risk or high-risk population, those are vaccinated. So I think that's an important consequence that we may think also to conduct in Germany.
Omicron is an opportunity. That's a phrase that I've heard a couple of times. I see you sort of looking slightly bemused.
An opportunity for what? I mean, this is still a deadly virus.
I've been amazed at how often I have heard that phrase or very similar phrases in the last couple of weeks.
Psychologically, it's understandable that, we have had 2 years of really bad news. And a lot of times with this virus, it felt like the worst case scenario came true. Now, Omicron falls a little bit outside of that scope because it is actually, from what we know, a little bit milder in the disease it causes than, say, Delta. Not necessarily milder than the virus it evolved from, which is important. We don't know what the next variant will be. But, I think people focus a lot on the virus and they say Omicron is an opportunity. But we are in the situation that we are in because we developed vaccines in record time and we vaccinated a lot of people around the world in record time. That is why we are talking about transitioning to some kind of endemic state. It is not because this virus itself is somehow, that harmless. It simply isn't. It's the fact that it is meeting a population that has a huge amount at this point of immunity. And in a lot of countries, that's vaccine-induced immunity and it's infection-induced immunity on top of that, which is why a country like the UK probably has a very high immunity wall to a virus like this.
OK, you mentioned earlier German virologist Christian Drosten. He is very influential here in the country. He says he believes we will get back to the kind of life we had before the pandemic. Do you share that optimism?
Yes, of course. I don't think this pandemic, a pandemic always ends. The question is how much death and destruction do you get along the way? And, the vaccines were our way of reducing that burden. It doesn't necessarily cut the time short that it takes for this pandemic to work its way into an endemic state. But it reduces the price that we pay for it. And that's why we want everybody to be vaccinated. And the sooner we get to that stage, I think the sooner we do get back to normal life. I do think there are some things that will stay for a while longer. I do imagine that even next year or the year after, we might, in winter, have certain restrictions like wearing masks, things like that. But I also think that that is a burden that we can all easily, shoulder after the last years of restrictions that we've lived through.
Suji, how do you see the future here in Germany for yourself? Do you share that optimism?
I think that I can say optimism and opportunity for Europe and the rest of the world means, I think, not so much optimism for China. China actually, economy grew in China during the pandemic, and now it's declining in the last quarter. So I think while the world now is dealing with Omicron in an open way, China might question its zero strategy.
OK, we'll have to leave it there. We've been talking about China and Omicron. I hope we've given you plenty of food for thought. If we have, do come back next time. Until then, bye-bye and tschüss.